Okay. So far I've got Midvale, Harriman, and Springdale, and Price. Yeah, Nick, the continued guidance, stay tuned. We're still waiting for Treasury Department guidance. I have a call tomorrow with the Treasury Department for an update of when they think they will have guidance about the implementation of the CARES Act. And then Brandy and I were on a call earlier today about this very issue revolving around the special session next week.
Cam, can I give a quick update while we're waiting on
Be my guest.
some clarification that I just received for, I think for the most part, those on the call are considered reimbursable employers for unemployment purposes. Where I want to end. I'll be quick. I see that the Lieutenant Governor has joined us. So basically what I've learned is that as a reimbursable employer, you are not responsible for the $600 added weekly benefit that will come from the CARES Act funding. And then the portion that you otherwise would have been responsible for, you're only responsible for 50% of that. So for example, if an employee files for unemployment and their weekly benefit were to be $400, they would receive the additional $600 on top of that. But as a reimbursable employer, you're responsible for $200, 50% of the original benefit. So.
Cool. Good to know. Good to know. So the LG will be with us in just a moment. That was his staff getting everything ready for him to come jump on the call. Jared in Santa Clara, the once a week is great unless something really important comes up. The tricky thing that Brandy and I have been living, and many of you have been living it too, is that things change by the hour and sometimes by the minute. And so we've been trying to send regular emails, but sometimes it's easier to just go on video and let people ask questions of the subject matter experts if we can arrange that. So that's why we were curious, since we did not do 2 last week, is if there was still an appetite to do a second one, just maybe not with Senator Romney, but with others. And in light of the special session next week and the governor's order expiring on, or excuse me, his directive expiring on Monday, there will be a lot to discuss in the next few days. Oh, Commissioner Milne, one of my all-time favorites. Hello there, Commissioner. You can't say hi to me, but I'm saying hello to you. And I loved your video out in Wendover a few days ago when you were visiting the mayor there.
Assuming I get the opportunity to talk to you, howdy, and thank you. I appreciate it. It was nice to go out there and do that for him.
Yeah, that was really cool. So thanks for sharing that online. That was cool to see.
Welcome. Thanks.
Kirsten, I see you there. I do not see your trusty companion, the Lieutenant Governor, so we can
That's right.
wait a couple more minutes.
He is with the governor right now. I just got a message and will be there shortly. So apologies for that.
No need to apologize when he's meeting with the governor. And Brandy and I were just saying that our lives feel like they change by the hour, by the minute. And for you, the Lieutenant Governor and the governor, it's by the second, or what's the sub time of a second?
Yes.
Whatever that is.
It really feels like that. And I want you all to know, I'm working from home this afternoon, but they're being very, very careful at the Capitol as well. You guys would probably laugh if you saw some of the social distancing around conference tables. And in fact, Brandy and Cameron, the last time you were with us in person, we were sort of doing that, beginning to do that, before we really understood the importance of it collectively. And now we Clorox before, during, and after meeting. I mean, quite literally during meetings, sometimes with the governor, we'll just pass around the Clorox wipes and do our best to stay safe.
That is great. Yeah. Well, thank you for all your work. So everybody knows Kirsten is the Chief of Staff to the Lieutenant Governor and has been a tremendous resource for Brandy and me, and by extension, all of you, as we've been trying to get questions answered and get information out to the membership. And so, Kirsten, thanks to you and your team for everything you've been doing over the last few weeks. This is exactly what we expected to do this spring, right?
None of, we were just thinking about all the vacations we were going to take after bill signing season was over, and it just didn't happen that way. But truly, thank you. You guys are such an important group of individuals for us to be communicating with, and we do lots and lots of video message calls all week long, but this one is one that we look forward to. You guys give us harder questions than some of the other groups, including the task force itself sometimes, which is great. And just the localized issues that you guys deal with are so important. And so we're just grateful that you make us aware of them, and hopefully we can help out sometimes.
Perfect. Well, thank you. And we're up to 167 on the call. So thanks everybody for taking the time this afternoon for the weekly call with the Lieutenant Governor. I don't think I have seen him yet.
He's here.
Oh, I do see you. Looky there. So Lieutenant Governor, thank you very much for joining us. And I look forward to the day when we can do a call and we can chat about the Jazz perimeter defense, but that day is not yet here. So take it away, sir.
But someday soon. Well, thank you so much, Cam, and I apologize for being a little late. I was with the governor, and he sends his regards. There are a few things that we wanted to just go over and bring to your attention. For those of you that weren't able to see the governor's press conference today, there was a big focus on the Paycheck Protection Program, loans for businesses, for small businesses. And when we say small businesses, we often think kind of in the 50 or smaller range. This is part of the CARES Act, the federal act, and I just want to let people know that it is for all businesses under 500 people, so 499 employees or less, and that really is a big number. It covers about 90% of the businesses in our state, and so we just encourage those businesses to apply. We need to keep the doors open, and I may have mentioned this before, and I apologize. I do so many of these that I sometimes repeat myself, and so I hope you'll all forgive me for that. But when we look at the unemployment filings in the state of Utah, and you've seen some of those numbers, I mean, it turns out that we're basically processing about 5,000 a day, which is about the max processing capacity we can have. We've had some days that are higher than that and some days that are a little lower than that, but that gives you just kind of a feel for where we are. Every 24 hours, 5,000 more people are filing for unemployment here in the state of Utah, and have been since all of this started in kind of mid-March. If there's a silver lining at all in that, it's that over 90% of those employees are furloughed right now, which means that they technically have a job to go back to. But that only happens if those businesses are still around when we get on the other side of this. And that has to be our focus. We talk about restarting this engine and how we're going to fire things back up when this is over. That only works if we can keep the lights on and the doors open. And that the business is still around to have these employees to go back to, and that's where the Paycheck Protection Program is so important. These loans that businesses can get, and by the way, if they're able to keep their employees, then these loans will be forgiven and they become basically grants. And so we desperately need this, and we want to throw everything we have at it. We're talking with the legislature as well to see what we can do on the state side to again make sure that these businesses stay open. Every dollar we use to keep a business open will save us multiples of that down the road when employees are able to go back to work. And so that's a really, really important one. I've talked a lot about testing, and I want to talk a little bit more about that. I won't go through why testing is so important. I think I've kind of overdone that just a little bit, but it is critical. Some good news, both ARUP and IHC were able to ramp up testing last week. And so has our Silicon Slopes group. In fact, I was just down at one of the testing sites in Utah County, one of the 2 sites. They've got 3 more that they're working to open this week, and it was really incredible to see how that was all happening, and also the innovation that's going on in the testing side. I mean, they're figuring out ways. The problem is the manual piece of the testing, when you have to after you get the swab and you take it in, you have to extract the RNA from the sample, and it requires a person to do the extraction, and it's very kind of slow process. And they found, they realized, hey, there's machines that extract RNA. They're used in agriculture. I think in this case, they're used in strawberry production and the seeds of strawberries. And they said, RNA is RNA. And so they worked with labs to say, yeah, we could actually make this work. And so they brought in one of these machines, and it's a machine that can process, it can do the extraction for 900 tests in 3 hours. And it would normally, I mean, they're doing now with a team of 8 to 12 people, they can only do about 500 a day. And so you can see how this is going to expand things. And again, hoping that over the next 2 weeks, we'll be able to get up to about 7,000 tests a day in the state. We have the capacity to do about 4,000 now. And that's a big deal. Now, on the downside is, and this is a trend across the world, but it seems to be maybe even a bigger trend here in Utah, and that is on weekends we don't get tested. And so we have this testing capacity that's expanded, and then Saturday and Sunday come around and hardly anybody goes to get tested. And I think there's probably a couple reasons for that. One, it's just we're wired that way. I know historically, when my kids have gotten sick on the weekend, we've just said, oh, well, let's wait till Monday. We don't want to go to an urgent care, or, we just kind of think through the way that this, that a normal illness would occur. It turns out the weekends may be the best time to get tested because there is so few people that are actually going to get tested. And so we're going to be thinking through how to encourage people to continue to get tested if you have any symptoms. So that's where we are with testing. We are running into supply issues. And this has been the problem at all stages. Early on, it was reagent. Now it's the swabs, the specialized swabs that they use to actually extract a sample to test from a person. They're like giant Q-tips, but they're not Q-tips. They're very specialized, and you have to have these. And we were running out of those in the state of Utah. We put out a call last week, and someday we'll write a book on the drama of how we've gone about trying to get these swabs. Ben Hart, who some of you know with GoEd, has actually been the lead on this. We're repurposing a lot of people in roles they never expected to have. Ben has been chasing down swabs all over the world. We almost had to send a private jet over to China to get some, and then China kind of stopped that. We found a place, a guy, an uncle of a cousin of somebody in Chicago who maybe had some, and they're on a truck right now. But the truck got delayed at a port of entry in Iowa because they don't have enough people working the ports of entry. And we actually have to authenticate these swabs to make sure they'll work. And it takes about 24 hours to do that. And we don't want to fall behind, and we're running dangerously low. So we actually sent the state plane to Cheyenne, Wyoming, to get some of these samples to bring them back so we can start authenticating them to make sure they're the real deal before we pay a lot of money for these and before the truck gets here. And those are the types of things. I just want to give you a flavor for when people hear we're really busy and they probably wonder what we're doing. Well, those are some of the things that we're trying to do. And so the good news is we've got 100,000 of those on this truck, and hopefully that all pencils out, and that will give us some wiggle room over the next few weeks as we continue to ramp up testing. In the meantime, better than chasing these down is to have them made here. And we have some incredible entrepreneurs here. We're working with Fred Lampropoulos and Merit Medical to produce these swabs here and sell them to other states that need them. And so they're working through that process, and we're hoping in the next week or so that they'll be able to actually start producing those. So again, I hope with these calls we can just give you a little flavor of what's happening and all the hard work that is going into this by incredible professionals here in the state. One of the things that we announced yesterday that we've been working on for a couple weeks, and maybe some of you saw this, but the Southtown Expo Center in Sandy has been stood up as an alternate care site, as basically a hospital overflow, and we have 250 beds there. We can ramp up to 1,000 as needed. And those will not be for COVID patients. This will be for low-risk hospitalized patients so that we can free up those beds for COVID patients in the hospitals. So all of our hospital systems are working together. It's just incredible to see that happening. So those are positive news. I'll tell you just a little bit on the positive side about the epidemiology. You may have seen that our numbers were fairly flat last week at about 170-ish cases per day, and then the last 2 days we've seen a drop down to the 70 range. Again, I would caution looking at that drop, because there was also a decrease in testing. So those Saturday and Sunday numbers are showing up in Monday and Tuesday results. That being said, it is preliminarily good news to see that flattening, and we're hoping that that's where we are, that those early decisions we made are really paying off now. But we're still, we want people to be very cautious and still follow the governor's directive. But there is at least some hints of good news there. I also want to talk about contact tracing. I talked a lot about testing, but contact tracing is equally as important. So the idea again is we test those that have symptoms. We find out if they're positive. If they're positive, then we trace back and find all the people they've come in contact with. So we isolate them, find out the people they've come in contact with, and then we isolate those people and test them to see if they have it. And so if we have enough testing that we can test people even if they're asymptomatic, and that would be very, very helpful. And so that's what we're working towards. But to trace down those people, it takes an army. And unfortunately, our departments of health, our local departments of health, have been historically understaffed. It's always been an issue, but specifically when we're trying to do something like this. And so we have 1,000 state employees who aren't as busy as maybe they would otherwise have been, and they are getting trained in contact tracing. We had 40 of them yesterday who started doing contact tracing. I think they reached out to 300 individuals, and we're working very diligently there. So that's a good thing. We also have increased our data inflow. I think we now have almost all the hospitals in the state. I think we have 43 out of 50 or 43 out of 53 hospitals that are now reporting directly to a centralized location. By the way, there are only 2 states in the country that have more than half their hospitals reporting together, and we're one of those, and again, almost all. So that's a huge deal for the state, and will really help us, because while increased testing, again, we know it's out there and we're not getting all of it. The one thing that we can know is hospitalizations, because we test those right off the bat and prioritize those tests, and that will help us find the hot spots. When we see increased hospitalizations, that means that we're missing more of this. The good news is we are now top 5 in the country when it comes to testing, and we are in the bottom 10 when it comes to hospitalizations per positive test, and that's a really good thing for us. By the way, our testing remains at 5%. It has been from the very beginning. So about 5% of all testing brings back a positive result, and that's also a very low rate, a bottom 10 rate, which is a good thing. So now some bad news. You may have seen that unfortunately this virus has gotten into some of our long-term care facilities. Now we have hundreds and hundreds of long-term care facilities throughout the state, but one in particular was very hard hit in Salt Lake County. I believe we have another one in Utah County that has seen an impact, and we have dozens that have seen a case or a potential case. And we very early on, we knew that this could be a problem. We had seen what happened in Washington and other states, and so we put in very serious measures in limiting visitors, in running fever testing and symptom testing for all workers and anybody coming into a facility. Unfortunately, what happened in a couple of these facilities is that an asymptomatic worker, someone who didn't know they had no symptoms, went to work, worked with lots of patients, and ended up infecting many of them. And so that's that's just been a huge concern, and it's forced us to change. Effective today, we have new rules in place that anyone interacting with patients in a long-term care facility will have to use personal protective equipment. So N95 masks, gowns, gloves, those types of things. And again, that's to prevent infecting those patients who are at critical risk in our systems. That takes up PPE, and PPE is one of the things that we're really struggling to get. We did get some orders in this week, and we're working every possible angle we can to get more of that. But that is important, and we want to get that message out to our long-term care facilities that even if people don't appear to have any symptoms, we still need them to wear personal protective equipment so that they're not spreading potentially asymptomatically the virus to those who are incredibly vulnerable. Okay, with that, let's see. I think that's probably all that I have to update you on. And let's go ahead and jump into some questions, and we'll see what we can do.
Perfect. Lieutenant Governor, how much time do you have for questions?
We have until 3:45.
Okay, perfect. Perfect, thank you. So Brandy, I'll let you start with your Easter-related question. We'll go from there.
Yeah, Lieutenant Governor, thank you. There's many questions and comments relative to the Easter weekend coming up. Can we get some assistance with some firm messaging? What would you say to our members about the messaging and discouraging people from traveling to their communities to participate in camping activities or otherwise?
Yes, so our message would be the same, and hopefully you got a chance to hear the governor's message last week, and I've asked him to reiterate that message this week on Wednesday or Thursday, and that message is very simple. It's don't go, stay home. If you're going, turn around and go back. It's just super critical right now at this point where we're starting to maybe again see that line flattening out and hopefully trending down soon, that we don't overwhelm our recreation places, and again, most of them that have very limited hospital capacity anyway. Unfortunately, President Trump was on with us a couple days ago, and we were talking about the hotspots in the country. And when we think about the hotspots, we immediately think about New York, we think about Louisiana, some of these places that have high density, and we've seen really high infection rates. And then they flipped to another map that showed the hotspots per capita. And what's interesting is they were almost all in rural recreation areas. In Idaho, of course, Summit County, which we've seen here in Utah, is one of those, and most of that comes from the ski industry and outside. But ski areas have been harder hit, and now you're going to see the same thing in more of the springtime recreation areas if we're not incredibly careful. We worked yesterday with the county commissioners down in Garfield County. To close Bryce Canyon at their request, and we're grateful for their leadership and their willingness to do that. It's something that we'd been looking at, and we were grateful for that recommendation. And think about that. I mean, Commissioner Tebbs, this is their livelihood. This is what they do. Ruby's Inn. This is everything to them, and they're asking us to close those areas, and it's the right thing to do. And so I would remind all of you to please look at the governor's directive under travel. The stay safe, stay home directive, it still applies. I'll read just a couple of these. Do not with people who do not live under your own roof. Limit travel only to essential travel. Essential travel means travel to, and list those down. Nowhere on here does it say Easter travel or spring break travel. So we would seriously encourage that. I also want to give some very positive news, and that is we monitor the traffic in the state, and Carlos Braceras at UDOT gives us these updates daily or every couple days. And it's working, and it's working as well here as in other states where they have more of a lockdown. People really are responding and really listening. Our traffic patterns have gone from about about a 90% utilization rate down to about 60% utilization rate, which is a huge drop. And that's with truck traffic staying at 100%, which we need. That's the supply chain. So if you take truck traffic out of that, it's significantly less than that, because we are the crossroads of the West. There's a lot of truck traffic coming through. And so, so I would just encourage people to be very, very careful. Now, we are getting questions about camping and what that means. And look, again, be smart about this. Camping, sure, yeah. If you've got a place to go where you're the only ones out there and you're not running into a lot of people, that's great. We we want people to not go to not go crazy. But to be very, very safe. The problem is that that's getting harder and harder to find. That where there are places to camp, you're going to see people congregating in large groups, and that's just a hotbed of viral transmission. And so that's where we really encourage people to be careful. Look, when we get through this, we're all going to take a vacation, and we're all going to go awesome places, and we're all going to have fun and celebrate together. But maybe this is one of those times where you set up the tent in the backyard.
Perfect. Thank you, Lieutenant Governor. At the beginning of the call, you referenced the PPP and the efforts that the state's making over the next couple of days to connect small businesses, well, and all businesses, to bankers and otherwise. I just wanted to give you an update that the Association of Counties, the League of Cities and Towns, and EDC Utah have all been using our communication channels to get the information about the PPP out to businesses. For example, every business licensed professional in the state, city, and county received all of that information and will share it directly with their businesses. And so just wanted to make sure you knew that we are trying to make sure that information gets in the hands of every business owner in the state. With that,
that's awesome. Thank you for your help.
Yep, absolutely. You just talked about this upcoming weekend. Let's skip past the weekend to Monday and what lies ahead next week. The governor's current directive expires on Monday. There are rumblings about the special session coming into session next week at some point. What can you tell us about both what may come after the governor's directive expires on the 13th and what local governments ought to expect around the special session? And then we'll have a follow-up question about the CARES Act and the Coronavirus Relief Fund after you hit those other small issues like the directive and the special session.
Yeah, well, thank you so much. So, so what can we expect with the directive? So right now, the governor, and basically every day, we sit down and review, and we look at all of those metrics that kind of guide the decision making. Where are we? What is the epidemiology? Are we getting on top of this? What does testing look like? I suspect that we will see the directive being extended for a period of time. We've known from the very beginning that the urgent phase, and this is part of the Utah Leads Together plan, hopefully you've all had a chance to look at that, would last 8 to 12 weeks. And we are right now in we've basically 4 weeks into that. We do believe that, and we're hopeful, and our goal is to get out of this sooner and to be able to start to roll back some of those provisions. Now, because people have responded to the governor's directive, to this point, we've been able to avoid a statewide order, and the governor actually has had several conversations with our medical professionals around the state, and it's something that we're being constantly reevaluating. But working closely with the counties and the local health authorities on what they can do to supplement that, where we are seeing an increased outbreak. And so I think again, unless things change drastically and people either aren't following the governor's directive, or we're seeing changes in the pattern of transmission or the extent of the transmission. So right now it's hard to say because things change on a day-to-day basis, but just know that will be reevaluated over the coming days, and we will stay in touch with you as those decisions are made. Now, when it comes to a special session, the governor actually has a meeting later tonight with the speaker and the president to talk more about what will some of the details around what will be included in that special session. But I do think it is safe to say that one of the big ones will be budgetary in nature. Looking at the state budget, making the changes that will be necessarily just to get us through the rest of this year, and looking at what next year looks like. There have also been several requests, in fact, requests from you all that I think are very important, and I know we can talk about some of those some of those directly, but we are very supportive of those changes. There are certain things the governor can do under with his emergency powers, and but anytime we can get the legislative branch together to help weigh in and give direction and represent all the citizens of the state, that's going to be very important. So those are the things that we're working on right now. I would like to talk maybe just briefly about what it looks like going out of the urgent phase and into the stabilization phase. We've been doing lots of research on our end, and on what those metrics could look like. There's a great article, and maybe we could even send this around, that the AEI, American Enterprise Institute, maybe forget what it stands for. Dr. Gottlieb had done some research on what it looks like to start to come out of this, because we know, again, we're not going to be able to do this social distancing forever for I think, emotional reasons, but also economic reasons and others. And if we had enough testing early on, we probably could have avoided this in the first place. But what it looks like, what are some of those metrics to get out of there? And that's one of the things that we're working on right now with our team of data experts, and working with the legislature to kind of lay out what that looks like. But they took that I guess it was kind of a white paper from AEI about how we get out of this. And the New York Times actually did a piece on it yesterday, kind of summarizing it. Some of you may have seen that, but we're happy to send that around just so people start to get an idea about what that looks like. And it's basically when you see 7 to 14 days of declining numbers, and we've got our testing and tracing ramped up where it needs to be, which we're as far as the states go, we're by far ahead of everyone else when it comes to that kind of machine, testing and tracing machine, that we're going to need to get out of this before everyone else. And so we're very optimistic and hopeful, but that's one of the discussions we'll be having with legislators as well.
Perfect. Thank you, Lieutenant Governor. And just so the 200 plus people on the call are aware, the League and Association legislative teams met today, finalized our list of priorities that we submitted to both the legislative branch and the executive branch, and we've been involved in conversations for the last few days about what the special session could entail and how it could impact local government. Brandy, your question.
Yes, so relative to the CARES Act funding, we're aware that the state will be receiving $1.25 billion. We're hoping that in the coming days we'll see some clarification on what qualifies as necessary and unbudgeted expenditures, and also the definitions for local government. But has there been any discussion, or do you know from the governor if there are guidelines in place, or what can we be providing to our membership to have them prepared for what documentation may be needed in order to identify those expenses?
Yeah, so we have had some initial discussions on this. We're all kind of waiting for the guidance that's coming from Treasury on that, and once we have that, then we'll be able to finalize exactly what we need from all of our local communities. But I would encourage everyone just to as carefully as you possibly can document expenditures and the things that you're doing, just so that when we know. And we're ready to pass that on, we can compile that as quickly as possible. It's going to be really important to make sure that we get those reimbursements out, and to make sure that we're able to keep our local governments fiscally solvent during the next few weeks and months. And so what I would say is just stay tuned on that. And as that guidance comes out from Treasury, please feel free to weigh in. We're going to want your help in collaboratively putting those lists together, and we do, and we're so grateful again for both of you representing your associations and organizations. But this is going to be really critically important. Some of us went through this back in 2009. And 10, and for those of us that were in local government back then will remember kind of what that was like. I anticipate that this will be very similar to some of the things we were doing back then.
To piggyback on what the Lieutenant Governor just said, the League and Association submitted a joint letter that our collective officers signed to the Department of the Treasury last week, seeking that type of guidance and clarification around definitions of necessary expenditures in local government. We have a call tomorrow with the Treasury Department, and we're hoping we get that guidance later this week. So then that facilitates the dialogue between the state and locals. And then the League and Association also submitted a letter today to the governor as well as to legislative leadership about the next steps once we do get that guidance. And both the League and Association have surveys in the field to our members, asking for them to track this information, collect it, and be prepared to make presentations to you and the governor and to legislative leadership. The next question that I have for you is more of a technical question, and it's one that's come up from several cities. This one specifically came from Dave Tuckett, who's the Payson City Manager. And it's about the implementation of the governor's Utah Leads Together plan. And this deals around the testing and temperature screenings at facility entrances and some of the best practices that businesses, cities, and counties are doing to try to make sure that the workforce that is coming to work are indeed healthy. So do you know how that testing impacts HIPAA laws, or how HIPAA impacts the type of procedures that are happening on the ground as people come into facilities? And just in general, what do people need to know about how HIPAA overlaps with the testing and tracing that's occurring?
So that's a really good question. And I am an attorney, but please don't take this as legal advice.
But you're a recovering attorney.
I'm a recovering attorney. This is true. What I would encourage is to ask this question directly to maybe your local health department. But let me give you a little bit of a broader perspective on this. What we do know is that testing and screening is allowed, and it is happening. In fact, right now in our emergency operations center, we do this, and I would encourage it. I mentioned that there is, unfortunately, asymptomatic spread is possible. However, symptomatic spread is by far the most common way that this virus is being spread, as people have symptoms and are coughing and they're feverish. And so if you do have people coming to work, it is absolutely acceptable to screen them. And what we do is we do temperature testing, and then we ask the question, are you coughing? Do you have any other symptoms? And have you been in direct contact with anybody who has tested positive for COVID? My understanding in a couple ways. So specifically on the tracing side of things, from a health perspective, there are fairly broad exemptions to HIPAA when it comes to those types of things, and it's critical to notify people, hey, you were in contact with John Doe, and this person has tested positive, and that does not violate HIPAA regulations at all. I'm sure I would be very careful if you do take someone's temperature and find out that they are feverish, not to email it around the office and tell everybody exactly, what their fever is. But it is not a violation of HIPAA. In fact, what we do is when someone tests positive, then we actually notify the employer. And we collect the names of everybody that would have had contact with that person, and we contact them directly. And so while there is some overlap, there is a broad exemption in this type of a situation for that does not violate HIPAA. So it can be done, and I suspect that, in fact, I don't suspect, I know that unless and until we have a vaccine, As we start to move back to some semblance of normalcy, this will be part of the new normal for a while. In that we, the wearing of masks, I think, will increase, and the looking for and screening people who may have symptoms before they come into the workplace will be more commonplace.
Terrific. Thank you. Brandy, your question.
Thank you. Lieutenant Governor, are you aware of any coordinated effort to address supply shortages? And when I'm talking supplies, I mean like groceries, essential hygiene products, and this isn't specific to urban or rural. In our grocery stores, there is a shortage. And especially for those vulnerable populations who are on fixed incomes and the challenges with getting the supplies that they need. Is there any conversation, or is there a coordinated effort statewide to address the shortage? Or how do we direct our citizens to get help in those areas?
Yeah, so I actually have a call later today with Dave Davis, who represents the retail grocery stores across the state, and that's a good conversation that we can have. We've talked about it, but I don't think there's been any real coordinated effort. The supply chain is still there; it's still functioning. Unfortunately, we have had some hoarding going on as this is ramped up. We also just, as a matter of fact, with more people being home, they're buying products that they need, that they're using more of than they otherwise would. I mean, toilet paper is the one that everybody talks about, and it isn't just that people are hoarding toilet paper; it's that they're using the bathroom more at home than they usually do, and so that's certainly part of it. I do know that several grocery stores have taken steps, and they've been able to open the store just for people on a fixed income early on after shelves have been stocked to help them. So what I would suggest working with your local grocery store to see if that's something that they would be willing to do. Another thing that many stores have done, in fact, the store in my rural area has done, is on many of these products, they limit the amounts per customer per visit, and that has certainly helped to increase supply to those that need it. But let me talk with him. I'm reaching out to him on another issue to see if there isn't something more we can do as representing that association to help those that are on fixed incomes make sure that they can get access to the supplies that they need, and I'm happy to do that.
Thank you.
Perfect. The next question has come up actually from a variety of cities. City Hall is open for business around the state. Those cities are balancing public health needs with social distancing, which at times creates some issues with current law. So, for example, the cities are permitting building and construction, but there are still some issues around the actual signature, what's often known as the wet signature. Sometimes that issue is from a utility company that won't sign a plat. Sometimes it's on the public side that you need to sign the plat. This is something we've considered requesting an executive order about. It's also something that is on our list that we submitted this morning for the special session, is to facilitate other types of signatures in state law so that things don't get held up. Have you heard this concern previously, and what are your thoughts about being able to address this either via executive order or in the special session, recognizing that you are a recovering legislator as well?
Yeah, thanks, Cam. So yeah, it is something that we've heard, and it's something that I'm very interested in trying to find a solution to. And I think that where I first heard it was actually on the notary side. In my office, we oversee notaries. We've put in a request with the governor to, as part of a potential order, to allow to loosen the regulations around remote notary. And I think the same principles would apply to this when we're looking at the wet signature on plats and doing that type of kind of remote signing potentially. And so so the answer is yes, it is something that we're interested in, and it's something that I support. And I like the idea. Again, we can do some of these things via executive order, we realize that that's a limited authority, and it's not one we like. It always feels a little constitutionally icky. There's a reason for it, and I'm grateful we've had it. We've been able to issue some orders to allow commerce to keep going and to make some really important decisions that we had to make. And when we have a legislature that's only in session for 45 days, this is the very essence of why this type of executive emergency authorization exists. But where we do have the legislature coming into session potentially very soon, it would be great to be able to get that taken care of and relax those regulations there. So I would
Okay.
definitely support that.
Okay, perfect. And that was a top priority for both the league and UAC. And looking at the time, Brandy, looks like the last question is yours.
Yeah, and I think the final question just was relative to grandma, which I'm assuming is basically the same response. We would have otherwise asked for some consideration for additional time to respond to grandma requests with limited staff in county and city facilities right now, but I'm assuming that your preference is to have us ask the legislature.
Yeah. So for those that have PTSD from grandma-related legislation, before that was actually that was the year before I came into the legislature, so I was not a part of that. But it certainly exists in lore as we have those discussions. But I would say, and we are impacted by that as well, and that is definitely one where we want to still be transparent, and we want to still follow the rules, and we want to still be subject to people and their ability to see what we're doing and how that works. But buying a little more time, I think, is absolutely reasonable under these circumstances. We've been fortunate when we've had some grandma requests in our office that the people making the requests have understood and voluntarily given us a little more time. But we recognize that that's not always the case, and so yes, I think that is one that is definitely worthy of legislative discussion, and potentially in order for the governor just to give us a little leeway, not to abdicate our responsibility to respond, but just to give us a little more time where we are short-staffed and we're still trying to work our way through this very kind of murky time. So thank you. Thanks for letting me come on, you guys. Again, thanks for all you're doing. Sure appreciate our local authorities, the feedback that you all are giving us. We're hoping that the communication lines are open. The governor always says, even in the best of times, that the hardest thing to do is to communicate. He likes to quote an old movie that he always says, what we have here is a failure to communicate. And we're trying to avoid that at all costs. And please know that the lines of communication are open, and we try to respond as quickly as we can. Again, you have great leadership with your organizations, and we're grateful for what you're doing. We're making progress. That's the takeaway. We're getting through this. There is a light at the end of that proverbial tunnel, and we're going to get through this together. So thanks for letting me join. Thank you.
Perfect. Thank you, Lieutenant Governor, and everybody stay in touch. We got a busy few days ahead. Thanks.